Thank you, Dagmar, for setting the stage for today's event. Now, I would like to take the opportunity to invite Dr. Rajendra Kumar, Director General, ESIC, to deliver the keynote address.
A very good morning to everyone. Ms. Dagmar Walter, Professor Srivastava, Professor Sharma, Mariko from ILO, all the participants here. It's my pleasure to present here today to speak on this very important topic of extending the social health protection to the uncovered set of workers. As you may be aware, ESI Corporation is the oldest and the largest organization in India which provides comprehensive social protection to the eligible workers. At present, I think some of you may be aware, we cover about 13 crore of workers, that's about 130 million. And 3 crore workers and 13 crore total population covered, including their families. So that's a significant proportion that we already cover. And our mandate over the years has been expanded to cover the entire country in terms of the schemes that we provide and in terms of the health services that we provide. This is gradually being achieved by notifying more and more districts under its coverage. At present, we cover about 600 districts out of 740 plus districts in the country. And we are covering more and more in the time to come. Under the Social Security Code 2020, which has been passed by the Parliament, the ESI Act, which is of 1948 vintage, that is going to be subsumed in the new code. And the new code's mandate is to extend the coverage to the informal sector workers by law. So once that act is notified and implemented, our mandate would expand to cover more categories. Even the workers working in units where the number is less than 10, which is our current cutoff for the coverage, they would get covered. Workers in industries where there may be only single worker available, even they would get covered. The informal sector workers, platform workers, gig workers, they all have been covered under the new code, which would be the mandate of ESI Corporation once that is notified. So in terms of the overall policy, in terms of the overall legal provisioning, the most important aspects have already been thought through, and we have a mandate in place to extend the social health protection and the other social benefits to the entire set of informal sector workers. So that's, I think, is the most important point that perhaps we all need to appreciate, understand when we discuss the issue of extending coverage to the informal sector workers. As you also may be aware, ESI Corporation provides not only a comprehensive health care package, including primary, secondary, and tertiary care to all the eligible workers. It also provides a number of other services, especially focusing on benefits. For example, sickness benefits, maternity, accident, death, also unemployment. During COVID, we had a special scheme extending benefits to those workers who became unemployed as a result of the COVID pandemic. We also had relaxed the conditions for unemployment benefits to the workers who were affected as a result of the lockdowns, other adverse impacts of the pandemic. So all these have been very helpful in addressing the challenges due to COVID. And over the decades, these schemes have been modified. They have been extended to cover more and more categories of workers, provide services in a more systematic fashion. So it has all happened over the last several decades. And our goal in future is to improve this set of services as well, in addition to the healthcare services that I mentioned. So for example, now we are trying to use technology in a very holistic fashion to ensure that the access to our services becomes easier for our eligible workers and their families. Just 2 weeks before, on 10th of November, we launched the online maternity benefit scheme, through which now all the eligible women can apply online for the benefit without the need to visit any of our offices in person. The documents can be submitted online. We have a interface which verifies the eligibility and extends the benefit. All the payments are now fully online, only to bank account, no checks, no other mode of payment. So it is very safe, and the person eligible only can get it. So we have a pre-verification process that is also now fully online. So the idea behind all these initiatives is to ensure that we provide access to our services to all eligible workers and their families. And for them, they need not spend time in visiting the office, our offices in person, because that entails spending several hours, loss of wages for them. We also are working on ensuring that our workers and their families, they are educated in using these digital and online interfaces. That's a very important part, because the workers and families whom we cover, they perhaps are not in a situation where they are aware by themselves or literate by themselves in using digital interfaces and digital technologies. So that's a key goal that we have, and we have launched massive campaigns all across the country. We have now launched mobile apps in the last couple of years to make the entire process of access to digital interfaces as easy as possible. So that's a key step. This process is going to get better and better, because we are now focusing on developing newer interfaces, easier interfaces, which can work even in remote areas with where perhaps the mobile connectivity may not really be of very high quality. The idea that I'm trying to mention here is that in terms of our coverage, extending access, and ensuring that all the eligible workers and their family are covered, we are adopting all efforts to achieve that vision. And once the Social Security Code comes into effect, then our basket of services will expand. The coverage will expand several fold. Perhaps the target is to, if you see the total number of workers who are in the informal sector, that could be about 350 million or maybe even more. So if that becomes the mandate of ESIC, we are fully geared up, we are prepared. We have actually gone through a number of internal exercises to really discuss and work out all details as to how our services will get expanded, how we will increase our presence in the uncovered districts, which are there now, about 140 of them, and how we are actually going to provide the healthcare services and other benefits to these new areas and to new workers. So all this has been done. It's a continuous work that we are continuously undertaking now. And we really hope that we can meet the challenge of extending our coverage to the new, much bigger set of workers once the mandate becomes effective. So that's the main vision that we have set for ourselves in the time to come. And I'm really hopeful that with the support that we have from the working population, the employers, I was going through some of the findings of the report, and it mentioned that the awareness about the ESI corporation and its scheme is not really very high amongst the employers, the employees, and their families, etc. So that is one area that we need to address, obviously. And once we expand coverage to more, that will become perhaps a more significant issue to really create awareness amongst all the new set of workers whom we would cover. So that's one area there where we need to really work more in the time to come. But with the strength that ESIC has, I don't know whether all of you are aware, ESIC, ESI Corporation is perhaps one of the largest entities in India in the government sector, with about 46,000 workers of our own. I mean, 46,000 employees of our own, including all categories, both healthcare and non-healthcare. Healthcare and the benefit side and the other staff, they are almost equally distributed. So we have a very large set of, we also have a number of supporting organizations. We work with the private healthcare providers as well through a tie-up arrangement where we can send our workers in case of need for, treatment which is not available in that location in a ESIC institution. So we have a vast ecosystem across the entire country, spread all over the country, where we try to provide the best of healthcare services and benefits to all our covered population. And this mandate, as you can imagine, is going to get bigger by many times once the number of workers whom we would be required to cover is really mandated upon us. So that we are also fully geared up. Our ecosystem partners are aware of this requirement, and all the state governments also are key partners in this because we work with all of them. In fact, the ESI scheme that we talk about, that's a scheme that ESIC runs through the state governments. So there's a difference in ESIS and ESIC. ESIC is the organization, ESI Corporation, Employees State Insurance Corporation, and ESI scheme is the scheme which we run through state governments, where we provide them with funding support to run healthcare institutions for providing healthcare services. ESIC also owns its own hospitals across the entire country, but we have a significantly smaller network which we own directly. ESIS is not owned by us, it is owned by the state. We provide them with funding to run those institutions. So that difference is also crucial because you can see the multiple layers of governance that we have, which we really need to manage more effectively. So ESIS, that is the ESI scheme, which is run by the states, that has its own set of issues. ESIC, which we run directly, we try to meet our requirements and we provide the best services to our workers in the best way possible. But both have a slightly different set of challenges, different set of issues to really address once the mandate becomes bigger under the new code. So this nuance, perhaps we need to really appreciate, and we need to keep in mind when we talk about covering more and more workers in the time to come. One more point that I would like to mention, and after that I would end, is that if you really see the healthcare ecosystem in India, there are multiple players. We have a central health ministry here. We have central health institutions, including AIIMS and other central government institutions, hospitals, etc. Then, of course, the states have the biggest responsibility because under the constitution, health is a state subject. And the states have the full mandate, and many states are discharging them effectively. And they have expanded services in the past, and now some states have covered a very large section of the population, almost 90% or even more. Some have even universal. Anyone can avail the health care protection provided by the state. So in this scenario where we have multiple entities providing healthcare services and multiple layers of management governance, central, state, local, in many states, even the municipalities, they also have their own healthcare system. They have clinics, they have dispensaries, they have hospitals, they have medical colleges as well. So in this scenario, as we can appreciate that with multiple sets of providers, there would be overlaps in the coverage. And there would be perhaps lack of awareness on the part of the person, the individual, to understand where he needs to go in case of requirement for availing healthcare services, whether he would go to a municipal healthcare institution or to a state provided one or to ESIC provided one or to a central government provided one. So if we really see this ecosystem, perhaps there is a need for having a model or having a thought process about convergence, which should actually help us in providing better coverage, extending coverage, and also ensuring that the resources that we devote to healthcare, they are utilized more optimally. And there is no, or minimal duplication and overlaps. So perhaps this is one goal that we need to really, understand, and we need to work towards achieving this vision of a converged, unified system of healthcare, which would really help us in achieving the goal of universal health coverage for health for the entire population. And in case of ESIC, ensuring that our social sector protection scheme, that is health and others, that is benefit health plus, that also covers the entire population. So I think if we work towards this vision, universal healthcare and universal social protection, that would really help us in meeting the objective under SDG 3 of the UN SDGs that talks about the healthcare coverage for everyone. So this is the broad outline that perhaps we all need to think about. ESIC is aware of, we are aware of this aspect, and we all are now gearing up our organization to really work toward this vision of universal social protection coverage to all, including healthcare and the benefits. So thank you very much for inviting me here.
Thank you for sharing your valuable insights, sir. Now I would request Professor Alak Sharma from the Institute of Human Development